at the age of 72 following IVF treatment. Daljinder Kaur and her 79-year-old husband became parents after 2 years of treatment at the Indian National Fertility and Test Tube Centre. But to talk about some of the issues that throws up now, here joining me are the gynaecologist, Dr. Gedis Gruzinskas, and child psychologist, Dr. Amanda Gummer. Welcome to both of you. Thanks very much indeed for talking to us. Dr. Gruzinskas, first of all, putting aside any potential ethical issues for the moment, let's talk medically first of all. What would you say the medical risks were of a mother of this kind of age in her 70s giving birth to a child, both to the mother and to the baby?
Thank you. I think this is a very sad story. I think that the medical issues were enormous. I think this lady is lucky. I think the little baby is lucky, and of course the husband is lucky. This lady's age at the time the baby was born is 72. My understanding, the latest figures on life expectancy in that part of India, average life expectancy, low 60s. So the medical issues are quite substantial. In as much as all the challenges that this lady has had to face during pregnancy were quite severe, as too were the challenges to the baby. The baby's birth weight's very low.
Well, yes, I think that the birth weight was just over 4 pounds, as I have read, or it's been reported. And Dr. Gruzinskas, just to talk about the medical side of it a little bit longer, the doctor who carried out the treatment for her is reported to have talked about carrying out a series of medical tests, including stringent cardio checks. They say that they showed that she was fit and healthy. The woman herself has said that she felt well enough and fit enough to cope, and it appears that the baby is healthy. So it does appear to have worked out okay, doesn't it?
Well, it certainly does, as we see in the picture, but this is what one might refer to as a retrospective diagnosis. When looking at these matters prospectively, investigations that are undertaken to assess a woman's ability to deal with the challenges of pregnancy are informative but not entirely accurate. The other thing that was a little troublesome when I read the article was who actually conducted the assessment. If the doctor performing the fertility treatment was conducting the assessment, then I could argue that there may be a potential conflict of interest here. It would have been far more appropriate, and perhaps this is what was done, that this couple, that this lady, would have been referred to another colleague, a physician, a cardiologist who's an expert and could provide an independent assessment.
Well, yes, and I don't know the details of that, so I can't confirm or not those kind of details. But let me bring in Dr. Amanda Gummer as well. So what's your view on this news that an apparently 72-year-old woman has given birth like this? Putting aside the medical side, psychologically, what can the impact be of someone of that age having a child?
Without knowing too many of the details of the case, I would imagine that the kind of the responsibility and that sort of emotional roller coaster that new mothers go through would be heightened for her. But my concern or my issue is really with the well-being of the child and the development of the child. And I think that bringing a child into the world, knowing most parents, I would imagine, bring a child into the world because they want to create a family, they want to nurture that child, and they want to help that child thrive and grow up. Now, maybe this couple has a massive support network, and maybe it's a big family, and the child will be sort of involved in that family, and it'll be able to develop those really important attachment relationships and be given all this sort of the love and the care that it needs. But if not, that child is going to be growing up without either of its parents fairly soon, I would imagine.
Well, yes, and yet there are children all around the world, aren't there, Dr. Gummer, who are brought up by their grandparents and have very happy childhoods.
Yeah, and I'm not saying that you can't have a happy childhood without having your parents nearby, but what I am saying is that parents who deliberately have a child knowing that they're not going to be around to look after them and nurture them, I question whether they're thinking of themselves or the child in that.
Dr. Grzynskas, what's your view of the kind of psychological side of things? In your view, do you think that medical doctors should take into consideration some of those factors when deciding whether to carry out medical procedures like this?
I agree entirely with Dr. Gummer here, in as much as the main issue should be the welfare of the child to be born. Well, the child has been born, and the child now needs to be nurtured. One of the reasons that I said that this is a sad story is that there's no evidence of any family around this couple who's going to be available when help is necessary. Coming back to your point about the psychological development and the maturity and maturation of this little baby, one hopes for the best for the future, but this little baby is in a most unusual situation, and I do hope would not be looked upon whilst it's growing up as actually being strange. So there are all sorts of challenges ahead for this little mite.
Well, Dr. Gummer, to answer the point raised there by Dr. Grzynskas, I don't think we're aware of what other family are around. There's only a limited amount that's been reported about this story. But some people watching might say, isn't this about individual choice? If somebody wants to have a baby, what should stop them, given that there are many people that might be viewed by the majority as not being ideal parents who go ahead and have children? So shouldn't it be down to individual choice?
Absolutely, and I completely respect that point of view. I think I'm not in any way comfortable sitting there saying who can and who can't have children, and I have no personal experience of knowing how much that sort of biological urge to reproduce, how strong that can be, and so I completely understand that there are people who want nothing more than to sort of have a family and carry on their family line. But again, my concern again is with the welfare of that child, and it for me it feels quite a selfish act to bring into a child into the world when you are essentially older than the life expectancy of your community, and I think that's that child, as a biological fact, will not have a parent. Seeing them sort of grow up and have their own children, and I think. The point about the stigma and the sort of problems that child is going to face. You're sort of weighting the world against him or her already before the child's really even been born.
Dr. Grzynskas, we don't have very much time left, but fill us in on what the rules are in this country about older parents wanting to have children.
Well, a very important issue to consider, and here the health professionals have a responsibility, and that is the care of the child, the care and welfare of the child to be born. And that, to me, seems here to not have been addressed at all. And as far as reproductive autonomy is concerned, to which Dr. Gummer has referred, it's a little bit easier for me to say that reproductive autonomy is not in the slightest bit relevant here. I think as far as that couple raising family is concerned, there could have been other ways, and much more nurturing and supportive ways, that this could have been done without this child being identified so easily as different.
Okay, well, Dr. Grzynskas and Dr. Amanda Gummer, thank you both very much indeed for discussing the issue with us. We appreciate it.
Thank you.